As Dr. Fong mentioned, I will give my usual summary of cases as well as our testing. So as announced by Dr. Fong, we have one new case of COVID-19, and I won't go into too much detail because he's already detailed the case. But this is the 14-year-old daughter of this hotel staff member that's been a focus of our contact tracing. As mentioned, because she entered quarantine on Sunday, April 18th, and she had no symptoms, and she tested negative when she entered quarantine, we do not believe that she was infectious at any point while she was in the community. She tested positive on day 4 of quarantine. With this latest case, there are now 20 active cases admitted into hospital isolation units in Fiji. 5 of these are older border quarantine cases that were announced before Sunday, April the 18th, and 9 are recently announced border quarantine cases. And then, of course, we have our 6 locally transmitted cases who all link back to the soldier who was infected while working in a border quarantine facility. 3 of these latest local cases were not infectious while they were in the community, and we know that because they had no symptoms at the time and were negative on their first test when they entered quarantine. They only tested positive later during the quarantine period while they were in quarantine facilities. So our total active cases in hospital isolation units again is 20, 14 are border quarantine cases, and 6 are locally transmitted cases. So now Fiji has had 87 cases in total, with 65 recoveries and 2 deaths since our first case was recorded on March the 19th of 2020. 63 of these cases have been international travel associated, detected in border quarantine, and the 6 recently announced cases have been our first cases of local transmission in over 1 year. A total of 46,423 COVID-19 laboratory tests have been conducted, with a daily average now of 562 tests per day over the last 7 days. Daily testing has, of course, increased in line with our response to the latest cases, with 828 tests conducted yesterday. Our overall test positivity is 0.2%, and our 7-day average daily test positivity remains at 0.5%. Now I'd just like to again reiterate some things that Dr. Fong has been talking about. We've seen around the world a resurgence of COVID-19. Last year we saw many developed countries, high-income countries, really struggle with their outbreaks of COVID-19. Their healthcare systems were near collapse or did collapse as a result of all those cases. We're seeing this happen again. So on behalf of all healthcare workers, I ask the public, please try to stay home as much as possible. If you do leave your house, wear a mask. Wash your hands frequently with soap and water, or use hand sanitizer. Download the Fiji Care app. The Care Fiji app. If you're out and about, maintain physical distancing of at least 2 meters between you and other people. We've been here before. We were here around this time last year, and we got through it. We contained COVID together. And again, together, we can do it again. So thank you, everybody it was a really great today going around. I went to a grocery store. I saw so many people wearing masks. And I thank all of you who are taking this on board. And please, more of the same. Thank you.
Thank you very much, Dr. Fong and Dr. Lisha. We are now open to questions from members of the media. Please raise your hand, and then we will repeat you for your questions. And also use the microphone. Fiji Village.
Shanil here from Fiji Village. Dr. Fong, can you just talk about some businesses who are not enforcing social distancing in the queues outside their outlets, because people were seen even today standing shoulder to shoulder, and some people were even seen without masks despite people checking at the entrance?
Yeah, we're working with a few other people. I know, I can't remember the name of the ministry, but I think it's there is one of the ministries that we're working with, MCTTT, that have a branch of, they have a group of persons that go around checking prices of items, and they've offered us some help in terms of helping to report on business houses that are not complying with our COVID safe measures. So that's good. As I mentioned, we are, this is a battle where we are trying to get as more people to willingly do the good thing or willingly do the right thing, even when nobody is looking. That's the whole purpose of our press conference, and that's the whole gist of what we are on about. We're trying very, very hard to not have to mandate anything. We're trying very, very hard to appeal to the good nature of us Fijians, to the fact that we're all working together to protect the nation. So, I mean, it'll be a great pity for me if I have to start putting in more punitive measures to get people to comply to the COVID safe measures. So for the time being, I'm still prepared to work on the idea of encouraging, persuading, and asking all our business houses to please implement those COVID safe measures.
Dr. Fong, Inoki Fiji-san, we've always had queries coming out from the general public. This is in regards to the three that had traveled to Moturiki straight after the funeral. And many had referred back to us just to ask us if there was any other contacts or maybe any other that had attended the funeral that made their way out of Viti. Just for the benefit of those watching, could you just clarify with regards to what the ministry had identified, if there was any other or if there was not, that had traveled out of Viti from the funeral that happened in Tabukumbu?
So far, we have, from the information that we have, the only ones that traveled out or that were outside, initially we were told everybody was in Lotoka. And then we got the family from Cunningham that came up. And then we got history about the Moturiki, the three from Moturiki. As we mentioned yesterday, it was a good thing too that the three from Moturiki all turned negative, and they've been remained negative testing twice and asymptomatic. So it did mean that a lot of other work that we had to do in tracking and creating screening zones was then turned down. We then could move resources away. There is a huge program that is happening in Lotoka, and so far we don't seem to get any more information about people from the funeral going out. Now, having said that, I'm not saying that there are rumors. There are plenty rumors. But every time you check the rumors, you find out, no, didn't happen. And I'd also like to say it's quite a lot of work trying to check rumors. It's because not all the rumors are based on facts. But we check and we try to see if it is correct or not. And so far we haven't had any, there's no strong evidence for us to say that more than that number of people have gone out.
Dr. Fong, Rakesh from Fiji Times. So you mentioned that no other shops and businesses should be open apart from pharmacies. And can you clarify? Can you clarify on this, please? You mentioned that since tomorrow, people have to stay home, and if they need to go, they can go for essential services only. Can you please clarify on this about the workplaces, which workplaces needs to be open and which are not supposed to be open?
I think you'll have to go back to some of my speeches that I've made over the last 3 days, where I've listed out a lot of what you're just asking me, and I've answered it. I must admit, I did not, I don't keep every single word I say in my mind to be able to repeat it. So the essential services are the ones I said. We do allow some supermarkets and pharmacies to open because we consider them essential. We don't expect construction companies to be out and about. But again, there's a reason why we selected Sunday to do this. We do know that there's not many places will be open, and we felt that that was a good day to choose to ramp up our screening programs. We just want that if we confine whole of Viti Levu, it's just easier for us to ramp up our screening programs at targeted places.
Dr. Fong, Josiah from FBC News. The health screenings that was done today in Cunningham, what mechanism did the ministry undertook to inform residents of the wider Cunningham area? As we received some information that some residents were stuck in traffic for almost an hour, trying to sort out some essential items, and when they reached their residence, they missed out the screenings.
As you know, to a large extent, we are responding to an acute event. And as when you respond to acute events, you can't get it perfect first time around. We are hoping that with everybody at home tomorrow, we can get more people. But we did need to work from this morning because we know that tomorrow we can't do everybody. I can't imagine the veracity of this statement, but I was told that we probably will be looking at around 15,000 persons. And we are hoping that if we can get close to 9,000 today, then it will be easier to mop up tomorrow. So there is another program happening tomorrow, and that should be help us to mop it up. Trying to warn people that we are coming in advance, it's sometimes difficult. It has its advantages and its disadvantages. Some stay and wait to be screened, some run.
Dr. Fong, there's a comment made by the Fiji Minibus Association that the drivers will decide for themselves if they want to follow the COVID-19 protocols. Just want to get your response to that because you clearly mentioned that it is a requirement now.
As I mean, the gist of what I'm trying to get at is I would really like the Fiji minivan. What was it again?
Fiji Minibus Association.
Yes, I'd really like the Fiji Minibus Association to come on board, encourage their members to wear the mask, knowing that you're doing it for Fiji, you're doing it for all the brothers and sisters who are walking around, at risk. As I mentioned also, I would really not like to have to resort to mandating it. And if it is within their own ability to refuse riders who do not wear masks. And if they go ahead and they refuse riders that do not wear masks, gradually, more and more people will wear masks.
So you mentioned at the earlier stages of the week about the fact that we have many cases out there. The ministry stepped up testing. Do we have some sort of benchmark to say we've reached, because all of the cases that have arisen have been within the cases that we've identified have been contained. Do we have a benchmark to say, yes, we are there, we're getting there, it is now time to ease off the restrictions?
If, the thing about dealing with the COVID-19 is that you have to plan. The plan is called what we call surge planning. There is no model that decides, how things will pan out. So what you do is that you do more than you need to. Okay? So when I say to the public, I expect to find cases, that means I'm really looking because I know I'm going to find it. But that doesn't literally mean that I will find it. But we are going further than we need to in some instances. We have checked, some of our testing parameters that we've used are way beyond the WHO requirement. We talk to Australia and New Zealand to ask them for their parameters, and we are aspiring for those parameters, developed country parameters. That's how serious we are about this thing. In terms of asking what is my benchmark, there is a time period that we discuss, in the morning. And personally for me, I'd like to see us go at this rate for 1 month and not pick up any cases. And then I'd feel comfortable. But I will have to defer to another group of experts to, to discuss this particular issue. I'll ask Rich, Akshay, if you want to add.
I think I'll just add to that. You've heard me mention in the last 2 days this measure called test positivity. Yeah? So I mentioned that our overall test positivity is 0.2%. Over the last 7 days, the average has been 0.5% per day. And over the last 2 days, it's held steady at 0.5%. That test positivity essentially is the percentage of positives we get out of the total testing that we're doing. You'll notice in some other countries like the United States, they actually use it as a benchmark to see whether they are testing enough and whether to see community transmission is escalating. So if you see your test positivity start to rise, that's an indication that there is more community transmission happening. If your test positivity goes above 2%, and in the US I think they use 5%, that's indicating that you're not testing enough. There are many more cases out there than you're able to test and find. So what we're doing is we're testing first the most high risk. We're looking at the context of the cases, primary context, the secondary context. We're looking at the neighborhoods of the cases. We're trying to test really thoroughly in there. We're testing healthcare workers. We're testing all of these high risk groups because we know that they're the highest risk of testing positive. And then we're even expanding even further. And we're still not finding so many cases that our test positivity is going really increasing or even hitting past the threshold. So this is, for us, cautiously, we're watching this and saying, okay, we are on the right track. But we will continue to do this, and we'll keep testing. We're increasing our testing every day. Yes, so if I would give some advice, so just look at those parameters that I've talked about, test positivity, etc., and then see how we use it as a measure of whether, if we're on the right track in terms of testing, in terms of the contact tracing we're doing, in terms of the screening that we're doing. Thank you.
Dr. Fong, what are some of the forms of psychological support services does the ministry has for those who are in our quarantine facilities?
There's been a number of organizations that have been trained. Empower Pacific is one of our group of counselors that we work with as an NGO. There's a few more other civil society organizations. What you call that one? I can't remember the name, but there's a number of them, a network of them that we work with. They worked with us during MSP. They worked with us during even during the cyclone, during our recovery efforts, Yasa and Anna. When we were doing, when we had people in those recovery places where we had to put them in, they also help provide social support. And we use the same network to also facilitate with regards to those in quarantine. I do know that they do provide Zoom services, and of course we can't get them to go in person, but they do provide Zoom services. They contact those who require psychosocial support. There are doctors that work around with those in quarantine. Doctors walk around, they make assessments, and based on questions that they ask, they highlight those who require psychosocial support, and they also. So we have a program running that inculcates both those who are watching over them and those who have the expertise to provide that service.
Dr. Fong, there are concerns being raised that the person who the soldier got the virus from actually returned from a business trip from India. I just wanted to ask if you will limit the business trips or will you progressively open up for business trips again?
Yes, we, as you mentioned, we have stopped the international flights, incoming and outgoing. There are some outgoing flights that are granted on a case-by-case basis. Medical, especially those who are going for medical treatment. And the only ones that are returning will have to be those who are coming back from medical treatment. We have a number of countries that we will put on the red zone. We've already done it. India is one of them. These countries that are on the red zone, usually our strategy has been that whoever comes from those countries, like for example South Africa, we've asked them to go to another country, stay there for 14 days, absorb the risk of that country before you apply to come to our country. We usually use other countries that are a little bit more, they've got a lot more resources at their disposal to help us facilitate some degree of protection for us. Otherwise, we just say no coming in. And that refusal has happened. The only people that we have never refused are our citizens. However, during this period while we are sorting out this current outbreak and sorting out our containment plan, automatically, because we are reducing the number of flights coming in, so our citizens are affected.
Dr. Fogg, Parama from Fiji One. You mentioned yesterday about public service vehicle and overcrowding in buses, and I was at the bus stand this morning. While many people are respecting the face mask protocol, a handful was not cooperating. Is the ministry looking at approaches to provide such basic items free to citizens who cannot afford, especially when it's one of the things that we're encouraging, when the ministry is encouraging everyone to wear?
This is one of the reasons I put out on my talk today about homemade mask. If you go to the Ministry of Health webpage, they give you instructions on how to make a homemade mask. As long as you have 2 layers of cloth and you follow the instructions so that it can cover the nose and come underneath the chin, that would provide some protection. That advice is compliant with WHO, CDC. They all provide that is. I think you might read some in some of the social media outlets. You might read something about cloth masks not being effective. That's not true. We get our advice from the best source, and we give that advice.
Thank you so much, Dr. Fung. Thank you, Dr. Lisha. Thank you, members of the media. That also concludes press conference for today. It's been a while, and have a good weekend.
Thank you.